So moving on, now we're going to be talking about actually completing a sexual health assessment and sexual health history. And so some things to just know right off the top. Yeah, again, kind of continuing on from the soapbox I was just on in the last video. We want to be non-judgmental. We want to be respectful of people. The reason this is so important, and this is important all the time, anytime we take care of any patient, right? But especially with this stuff, when we're talking about people's sexual health history, is you want to have a good therapeutic relationship with your patient. Because if you don't, they're not going to volunteer information that might be really important for you to know and to be able to act on, right? Like when we talk about someone's sexual health, it's a very private matter. I mean, again, I joked at the start, like, if you want to get me fired, this is the lecture to do it because, most people don't like to talk about their sex lives. I also don't really like talking about mine. Um, I'm sure that's true for a lot of people. It's a very private thing. It feels awkward to talk about and stuff. And so, people aren't going to talk about this stuff with you if they don't feel like, yeah, you're not going to judge them, that you're there to, again, to be a professional, to help them as best you can. So again, some of the things that we ask them, we got to ask them like, are they currently sexually active and what kind of sex acts do they engage in? How many partners do they have? What do their genitals look like? We actually have to look at their genitals. And then, yeah, what kind of pain, tenderness, swelling, discharge, do they have any of those things happening? Those are all important questions. And again, you're not going to get good answers to them all the time if you don't build a good rapport with your patient. And the only way you can do that is to be respectful and non-judgmental and to treat to not make assumptions. And this is true for really everything in healthcare, but again, especially when we talk about kind of more private issues like this, it's especially true. If you see somebody who, and you kind of judge them based off of how they look about some of these questions, like, are they in a committed relationship? Are they sexually active? Do they use protection? What kind of sex acts do they engage in? What kind of sexuality do they have? If you judge people based off their appearances or how they talk or interact with you, and you don't ask these things of everybody, you can end up missing vitally important details that could lead to different health outcomes for them, or maybe even a lot of people, depending on their partners and stuff like that. So it's really important that you ask the same questions of everyone, that you do it in a non-judgmental way, that you're respectful. Again, when we do these kinds of assessments, if you're asking somebody about their sexual health history, you're going to have to touch also potentially on issues like human trafficking. But I mean, I don't want to be a downer. I'm sorry, but sometimes you might have to interact with people who are being trafficked. You might have to interact with people who are victims of domestic violence, and people are not going to share information about those things unless they feel comfortable, safe, that you're an advocate for them, that you're going to help them, and that you're kind of giving them opportunities to talk about these things, and that you're asking questions, and you're not just, you know, thinking off the top, you're not just dismissing some of these things, right? Like, don't ever assume that someone isn't a victim of domestic violence. Don't ever assume that someone isn't a victim of sex trafficking just based off of, oh, they look too put together. They look, oh, they don't seem like the type that would do that, or they don't seem like the type who would do this. We can't make those assumptions. If we do, we could end up really doing a disservice to our patients and the people around them potentially. So again, I know I got up on another soapbox. I apologize, but yeah, it's hard not to when we're talking about some of these issues. So when we do our health histories and our assessments, big thing we want to do is use the five P's. So the five P's are just things we want to ask them about. So the first one, and not in no particular order, but partners. How many partners do they have? What kind of partners do they have? Right? So are you in a long-term monogamous relationship? Are you not in a monogamy? Are you having sex with, how many people have you had sex with in the last year? Like that's usually a good way to ask it. How many sexual relationships have you had in the last year? What kind? So are you a man who's having sex with men? Are you a man that's having sex with women? Are you a woman, a group of women? Are you a woman that's having sex with women? Are you a woman that's having sex with men? Are you, having sex with either or? Yeah, it just depends. Um, are you, yeah, yeah, how many partners, what kind? And that's important again because it gives us information about their practices. Um, what kind of protection they might need to be used, what their risk for exposure to STIs and things like that might be. Prevention of pregnancy is the second P. So what, if any, measures are you currently taking to prevent pregnancy? Are you wearing a condom? Are you doing anything else to prevent pregnancy? Not just prevention of pregnancy. It's not just a question of what are you doing to prevent pregnancy, but are you trying to become pregnant? Like you'd also think of the second P as just pregnancy, question mark, you know? We usually talk about prevention of pregnancy because we're trying to help people avoid unwanted pregnancies. It's a lot easier than sometimes trying to help people become pregnant when they're struggling to, right? But it can also be a question of, yeah, are you actively trying to become pregnant? If so, are you tracking your cycles? Are you tracking when, you're ovulating? Have you been to a fertility specialist? These kind of things. These are important questions because somebody wants to get pregnant. We want to help facilitate that. If someone doesn't want to become pregnant, we also want to help facilitate that, right? Um, Protection from STIs. So again, STIs, sexually transmitted infections. What, if any, measures are you currently taking to prevent transmission of STIs? Now, this is the third P, and it's not the same as prevention of pregnancy, although a lot of people might think that, well, they kind of go hand in hand. Not necessarily. There's a lot of stuff you can do to prevent STIs that will not help you prevent you becoming pregnant and vice versa, right? So just because someone is taking stuff or doing things to prevent getting pregnant doesn't mean it's going to protect them from STIs. So hormonal birth control will help prevent pregnancy. It doesn't give you any protection from STIs. And some of y'all listening to this are going to say, well, yeah, duh, I know that. And some of y'all might say, I didn't know that. And that's okay. But it's important to know that any of the stuff that we go over that you think, well, that's obvious, like, yeah, I know that. Never assume that your patients know this stuff, and this goes back to we don't make assumptions. We're always respectful. A lot of people, again, I mentioned before, sex is an issue that a lot of people don't like to talk about, and it's part of why we need to have a non-confrontational, non-judgmental, respectful approach to talking about it with our patients when we need to. Again, when your patient has a, you know, foot fracture and they come in, you probably don't need to ask them about their sexual health, but it could come up, depending on maybe some other comorbidities or something. But if you're working on an ortho floor, you're probably not usually asking people about this. But if you work in maternal infant health, you're going to be asking people about this. If you work in a health clinic, you're going to be asking people about this, especially in a college town like Gainesville. Um, so, which is where we live. If you're watching this and you're not currently in Gainesville, but the yeah, these are questions we do have to ask people. So you can't assume they know stuff. Some people might think that, yeah, if I take hormonal birth control, it'll protect me from STIs. Some people might use condoms, but they might not be using them correctly. And so it might even be appropriate to ask them, well, can you show me, like, not on yourself maybe, but on something like on a banana or something, can you show me how to put on a condom? Can you show me the condoms you're buying? Like, what do they look like? How are you storing them? There are people that will do all kinds of things that they think protects them from pregnancy or STIs. Some people use what's called the rhythm method, which is like they monitor someone's cycle and they just have sexual relations on like safe days. And I had an anatomy teacher when I was in college who actually went on to become the chief of medicine in North Florida for a while. He was a longstanding physician here in the area who adjuncted as an anatomy instructor and helped train a lot of nurses and stuff. And his name was Scott Medley, but he always joked that he'd ask us in class, you know what they call people who use the rhythm method? They call them parents because it's not very effective because you can have sex on days that someone is not ovulating, but still get pregnant because sperm can live in the vaginal canal for several days. There's a lot of things that can happen. So, yeah, the most effective way to prevent pregnancy and to prevent STIs is the use of latex condoms. Now, again, there's other ways to do it as well, and there's other things. It's not a guaranteed thing, but it's the most effective protection, right? I guess really the most effective protection would be to not have sex. But again, we don't assume that our patients aren't going to have sex. If you remember the concept definition we talk about, it's something that encompasses all these issues in people's lives, and it's sex is something that we're driven to pursue with people and that we want to do with people we love, and so we shouldn't assume that our patients are going to abstain from sex. It's a very dangerous assumption to make because if we assume that and they don't, um, then what protection do they have? So Again, a lot of times the best case is we want to encourage people maybe not to have sex in some cases, but we can't just assume that they're going to follow that advice because people like to have sex. It's just a it's just a reality. Maybe not everyone, but a lot of patients do. Um, so yeah, so we want to make sure we talk to them about like what are they doing and really get into it because they might be using products incorrectly. They might not know how to use protection effectively. They might not even be using protection. So we need to address that. The practice. It's the fourth P. What kinds of sex do you engage in? How often, if ever, do you use condoms? What kinds of sex acts do you engage in? It's kind of it's an extremely personal question, and some people might be like, well, what do you mean? And it's like you can ask, well, where do you put your genitals, and where do they put their genitals when you're having sex? That sounds a little forward, but it's very straight to the point, and it's what we're asking them. Again, it's not saying, well, you're not getting embarrassed. You're just where do you put your genitals? Do you put your penis in their vagina? Do they put their penis in your mouth? Do you put your mouth on their vagina? I'm not trying to be graphic. I'm just saying these are the things that we have to ask people sometimes. And the reason is not just because we're nosy. It's because different practices of sex, they can also lead to different risks or potential for spreading of STIs and even some, I guess, any infection that's spread via, sex is an STI, but some that we would not usually consider STIs. For example, you can get GI infections through engaging in oral sex, and it's something that people sometimes get, and we don't know that if we don't ask, like, are you engaging in oral sex, or if they don't volunteer that anyway. And then, so again, it's very personal. It can be a little, challenging sometimes to ask people and navigate that, but it's something important we need to ask. And then the last one, the past history of STIs. So, do you have a history of STIs? If so, which ones? When did you have them? Maybe ask them what kind of symptoms they had. When did they resolve? What treatment did you have? The reason is because previous infections with STIs is a risk factor for a lot of other STIs. Most STIs, have a risk factor of previous STI exposure. One is because of the practices. Like if you got an STI, it's not always the case, but it's possible that you're engaging in practices that are not safe and that, are helping maybe increase your risk for STIs. But also some STIs, just by having them, it makes your body more susceptible to other ones. Even if you're using, protection and stuff, you're more at risk for it because you've been exposed to one or that one previously, and so your body's less able to fight off other ones. And so, like a really common one is, HIV. If you have HIV that's developed into AIDS and it's not being treated and managed, it's very, very easy to contract other STIs because your immune system is totally impaired, right? And yeah, there's some other examples as well, but just generally, past history of STIs, it has a potential to be a risk factor for becoming infected in the future with STIs. So we talk about STIs. It is STIs are considered an epidemic in the U.S. It's estimated that about 1 in 5 people in the U.S. have an STI, and honestly, it's likely much more than that. A lot of people, I know this statistic is a little outdated, but it was the highest at the time anyway. Um, a lot of people have a misconception about STIs. You'll hear sometimes people joke that, oh, what age demographic has the highest STIs? It's actually, older people, because and there is some truth to the fact that older individuals are oftentimes at higher risk for STIs because of the fact that they aren't as worried about pregnancy. And so they might stop using things like condoms that are helping to prevent pregnancy, but also are helping to prevent STIs. And so it can lead to, yeah, an increased risk for STIs. So it is true that older individuals can be at a risk if they're not using protection for that reason. But the reality is 15 to 24-year-olds, that is the highest age demographic for STIs. So young people have the highest incidence. And it's important to know that because, yeah, when we talk to young people, again, if you talk to a 15-year-old, we might like to think that they're not having sex because, oh, well, they're not legally supposed to, really, technically, but they do it. People do this stuff. They have sex even younger than that in some cases. And it's not me saying it's good, bad, any different. It's just it's the reality. And we have to deal with reality as it presents itself to us as care providers, right? So we have to acknowledge that, yeah, that a lot of young people, they make up about half of STIs. And yeah, a big part of that is because they're not aware of a lot of this stuff. They haven't gotten adequate sex education. Maybe their parents are too embarrassed to talk to them about it. Maybe their health teacher was, a coach that had a free period and they weren't trained on how to talk about, sex and stuff, but they were, I always say that because that was my health teacher in middle school was a coach who, they had a free period and that's what they put him in the health class. So no disrespect to coaches. Some of my favorite teachers in school were coaches. But the reality is they might not be trained in how to talk to adolescents about sex. And yeah, imagine you're standing in a room of 20, 30, 15-year-olds and you're having to explain to them things about sex and how to have sex safely and stuff. It'd probably be a little awkward. It'd also be awkward if you were standing in front of a room of 65-year-olds and having the same conversation. But as nurses, sometimes, depending on the setting you work in, we have to do these things, right? It's also the case that, and this goes back a little bit to like, questions around disparities in healthcare we were talking about in the first video. Oftentimes, women or people with female reproductive organs suffer the worst effects of STIs. And part of that is biological, part of it is socioeconomic. So oftentimes they shoulder more financial and treatment burdens than men. Um, Part of that is because a lot of these STIs, they manifest differently in men and women. And oftentimes the manifestations are worse in women, or they have the potential to be worse. They have the potential to cause a lot more significant problems long term. It's not to say that they can't also cause problems for men as well, but just the risk is a lot greater for really adverse effects for women. So some of these diseases, they can cause things like pelvic inflammatory disease in women if they're not treated, and that can lead to death. The woman at worst, obviously, could also lead to things like infertility, which obviously, if you're wanting to be pregnant one day, it'd be very heartbreaking and horrifying. Um, but oftentimes, also, some of these STIs, the manifestations and signs aren't readily apparent. So the longer they go on, the harder they can be to treat, and the worse the outcomes can be that can lead to things like, yeah, PID or stuff like that. So again, men also suffer some of these things, but just overall, women tend to shoulder a lot more of the financial and treatment burdens just because of the nature of the diseases. And so on the next series of videos, we're going to be going into actually a few, not all, but the kind of the big STIs. So I'll see you in the next one.